infiltration and reaspiration of scolicidal agents into the cyst and various surgical procedures and albendazole. We do total splenectomy in the larger cysts of the spleen, which can be done by open approach or the laparoscopic approach. I am presenting the case of a 46-year-old male who presented with right and left upper quadrant pain and fever for 7 days. On palpation, a 12 by 12 centimeter swelling was present in the right upper quadrant, extending 10 centimeter below the costal margin. Another similar swelling was present in the left upper quadrant, progressing towards the midline. Ultrasound revealed multiple large hepatic and splenic hydatid cysts with daughter cysts. Here is the CT picture of the similar findings, where we have the coronal and the axial cut section showing a 13.8 by 15 by 11 centimeter cyst in the subcapsular location in segment 7 and 8 of liver, which is the most common site of the hydatid cyst in liver. Another similar cyst measuring 13 by 10 by 12 centimeter was present in the splenic parenchyma reaching up to the subcapsular surface. So based on our findings, we underwent pericystectomy and total splenectomy via open approach. Post-op period was uneventful and albendazole was given for 6 weeks after surgery. No recurrence was seen on follow-up and we sent the specimen for histopathological examination and the findings were consistent with the Echinococcus granulosus infection. So we know that splenic involvement in hydatid cyst is rare and the clinical presentation lacks specificity. And early diagnosis and management is important to prevent the complications. Treatment is determined according to the stage, the size, and the relation of the cyst to the surrounding organs. Total splenectomy is the treatment of choice for giant splenic cysts. The infrequency with which splenic hydatid cyst is encountered makes it a formidable early diagnostic challenge, especially in the non-endemic areas. The endemic areas of hydatid cyst include the Mediterranean region, and the complete aggressive resection is the gold standard treatment of patients with hydatid cysts of liver and spleen, and we aim to remove all the cysts to prevent complications and to prevent recurrence. So, I conclude that hydatid cyst should be considered in the differential diagnosis of all cystic masses in the spleen, especially in the geographical regions where the disease is endemic, and should be managed accordingly to prevent life-threatening complications, which could include anaphylaxis. Thank you.
So, is there a guideline for starting the control of therapy? For how long is that?
We continue this with 6 weeks.
Why 6 weeks? Is there a guideline, standard guideline made by the WHO?
We should give it till 4 to 6 weeks.
There is no guideline. Along with the albendazole, you have to have some other drugs. Like resistance. So you must read it, right? Okay. So any preoperative preparation before you are planning for this treatment? What preoperative preparation will do?
Preoperatively, we have to give antibiotic course and vaccines to prevent the Herbicidal agents also are given post-operatively. We start albendazole. Preoperatively also.
Listen to your question first. Give a paused and answer. Since you are in a learning phase, we also at this age do that way. Listen to the question and answer specifically. It is asking about your pre-operative preparation for this patient. Okay? This is not a simple preoperative procedure going for a splenectomy. So it is, you are contemplating a splenectomy, but something pathology. What is your preoperative preparation you will do in this case?
Preoperatively, we will start the patient on albendazole and we will give antibiotics.
Dose. I am asking you the dose. How the dose you will give?
400 mg BD. 10 to 15 mg per kg.
Okay, good.
If it is elective, then we start elective.
Was this your case elective or emergency? Can you be specific?
Elective.
Elective. So answer to that?
We start 4 weeks before and continue till 6 weeks, 4 to 6 weeks later.
Okay. Next.
Preoperatively, we should also give antibiotics to prevent in post-op infections, and we also give start vaccinations, which is started 2 weeks before planning splenectomy for preventing the opportunistic infections post-splenectomy. Which vaccine? Pneumococcal vaccine, meningococcal vaccine, Haemophilus influenza vaccine.
Which scolicidal agent you use?
Scolicidal agents could be, we used,
In your case,
we use hypertonic saline,
percentage?
20%.
You prepared it or you got it ready made?
We got ready.
If patient is not affordable, then how will you prepare it?
We will get a 3% NS and then concentrate it.
It is very simple, 20%. Take 1 liter autoclave saline, put 20 gram of this Tata iodine namak in it. Iodine also scolicidal agent. Then re-autoclave it and use it.
The most common thing which you use in each and every cases of surgery is dash, and which is used as a scolicidal agent also.
Betadine 10%.
Very good.
Okay. Thank you. We'll answer the next one. Yeah.